evening to all of you and a warm welcome to yet another of our series of webinars, the FemTech360 Webinar Series, where we hope to once again connect with all of you, collaborate, and solve a lot of your doubts, your problems, your misconceptions and myths that you all may be harboring about pregnancy. And it is indeed very heartening to see the number of participants increasing with every month that we are doing this series. And as usual, I encourage all of you to key in all your questions as we move along. We will be dealing with a lot of things, but you may be having doubts different from what we may be talking about. So please feel free to key in your questions as we move along, and we'll try to solve them as and when we can take up your questions. Please keep in touch with us through the whatever has been put up on the slide, through Instagram, Twitter, your Facebook, YouTube, LinkedIn, and we're always here to help you. So let us begin this journey of pregnancy. The saying goes that well begun is half done. So we encourage all of you to actually come in for pre-pregnancy counseling. Even before you all are pregnant, please do come in for a checkup because it is important to start well. If you start well, most of the time the pregnancy goes along very well. However, even if you have not come for the pre-pregnancy checkups, during the checkups itself, during the pregnancy itself, we are here to guide you along. So why do you need the pre-pregnancy checkups? First of all, we will be checking your height, your weight, to see if your weight is optimal for the pregnancy or not, for you to go ahead with the pregnancy or not. Depending upon your height and weight and the BMI or the body mass index, we will be advising you about the diet that you need to follow, the exercise that you need to do continuously. However, we don't usually tell you that you need to come to a particular weight before you can conceive. So some of you who may be overweight or who may be obese, please be in the process of trying to lose some weight, but do not expect magic. Do not expect things to happen overnight. And, you'll come to the ideal weight and then plan pregnancy. Don't bother about that, but just be in the process. So continue with your exercise and your diet, a healthy diet. One of the other important reasons why we call you for pre-pregnancy counseling is to put you on a particular vitamin called folic acid. Folic acid is a vitamin which actually used to be available in plenty in our food, in fruits and vegetables. However, years ago, when they saw a lot of babies being born with brain and backbone defects, they realized that the dietary supplementation of folic acid was not sufficient. The way our fruits, vegetables, and stuff, we are growing them nowadays, the way it's being cooked, the way we are consuming it, most of it is lost. And the deficiency of folic acid was leading to a lot of spinal cord, that is the backbone, as well as the brain deformities. So it has become the norm throughout the world to put all women who are planning on a pregnancy on 5 milligrams of folic acid even before they actually conceive, so that the blood level is very good of folic acid when you get pregnant, when the conception happens and the baby's growth is taken care of. So we will be putting you on this vitamin. We obviously advise you to drink lots of water. Hydrate yourself very well. We will be dealing with this shortly, how much water to drink and all that. And most importantly, we will tell you to take care of your mental health. It is not like in the olden days that, we are living in a joint family. We have a lot of people around to help and take care. And pregnancy nowadays has become a huge milestone in a couple's life. So take care of yourself mentally. Don't get bogged down by the problems or the complications which we may perceive during the pregnancy. So start off pregnancy very, very happily so that you can go through with the entire journey nicely. As I said before, in this session, I will be telling you about what all we will be dealing with. And as we move along, please feel free to key in your questions. Can we have the next slide, please? So once you conceive, obviously, nowadays, regular checkups are essential. Some of you may even ask us why so many checkups, and we will deal with that also later. But it is essential either virtually or in-person checkups during a pregnancy so that we can pick up at the earliest if there is an issue, if there is a problem, and pick up early will always lead to treatment as well early if there is a problem. And keeping in touch with your obstetrician, either virtually or in person, will help calm your nerves also down. You know that things are going well, so you are reassured about the health of your baby. So once you know that you're pregnant, you're going to come for regular checkups, and we will be guiding you when your next checkup will be. Some of the common symptoms that women may face, next slide, please, may face during the pregnancy, we will be dealing with. Just because they show in the movies vomiting does not necessarily mean that everybody has to have vomiting. So do not compare your pregnancy with somebody else's and expect to have a certain number of symptoms. So coming back to your mental and emotional well-being, okay, be confident about your pregnancy. And all of you must understand that once a pregnancy forms, that time itself, the fate of the pregnancy has been decided. So when we are checking you, it is only retrospectively that we are seeing that the baby is fine, and we are monitoring the growth, the well-being, the formation, and reassuring you all. So most of the time, you guys cannot go wrong with what you all are doing. So take care of yourself. Listen to your body first. Have enough mental and emotional support all around you. And do not Google and look at the possible complications and think that you're the one who's going to get all these complications. So avoid Googling and, getting unfiltered information by discussing pregnancy and your baby with people around you. That is not at all worth it. It only leads to more mental and physical, emotional stress. Next slide, please. Right. So diet and nutrition is something every pregnant woman, if not the pregnant woman, her family members ask us. That is one of the most important things, that the worry or the doubt in all your minds as to whether you all are eating right. So nutrition, what we will tell you invariably is not to make any major changes in what you all are eating. Okay, the only thing that we say is do not focus on gaining too much of weight during the pregnancy. If you all are already starting off with a high BMI, it is important to restrict your weight gain to a certain number so that you don't struggle post-delivery to lose the excess amount of weight. What the baby requires in terms of nutrition is more of protein. So you have to focus on the protein intake. Carbohydrates are only for your immediate energy, that is day-to-day functioning of your body, immediate energy levels. So we usually say that keep the carbohydrate to just the essential amount. What I mean by carbohydrate is the rice and the rotis that you all may be having. So keep that to the essential amount. Do not overdo that. Okay, and we strictly say not to have too much of sweets and chocolates and ice creams, cakes, because these are all simple sugars which will make you put on a lot of weight. Your family members may be very happy saying that, okay, you're putting on a lot of weight, but it is your weight, and these things only increase your chances of developing diabetes in pregnancy, do not really reach the baby. So restrict that. Fat, of course, always is a very, very small amount. Fat is required. It is very essential for the brain development of the baby also. So you cannot completely go off fat, but please restrict it to the minimum. So next slide. When we're talking about nutrition and diet, the next thing that we talk about is the exercise. What are we doing in terms of exercise? Activity 2, we usually say, once you get pregnant also, do not restrict your activity too much. Can we have the next slide, please? Do not restrict your activity too much. Please be normal. Continue your accustomed activities, but all we say is do not start anything new. The importance of hydration, extremely important, especially in a city like Bangalore, where we don't sweat so much, we don't lose so much body fluids, so we do not feel so thirsty. we forget to hydrate ourselves. We forget to drink enough water. But please remember, in pregnancy, the blood becomes dilute. There is excess water retention in the body. So if we do not hydrate ourselves and drink enough water, we will end up getting dehydrated. So it's very, very important that either at your workplace or at home or wherever in your eyesight, please keep a 1 liter bottle, and whenever you remember, pick up the bottle, drink some water, so that if you keep doing that every hour or so, invariably you will finish at least 2 liters per day. Ideal maybe 3 liters, but it's a little difficult to achieve. So at least 2 liters of water per day. Keep drinking as and when you remember. So hydrate yourself very well. Next slide, please. So diet, hydration, exercise. Now, what are the common symptoms that one may encounter during the pregnancy? Heartburn and acidity is something most of you will face. In pregnancy, there is hyperacidity, meaning that there is excess secretion of acid, that is gastric juice, from the stomach. And you all know how acid can be. It is a substance capable of causing burning. So the acid requires some amount of food, so that we tell you to have small and frequent meals. Especially in the first 3 months, do not worry about the quality of the food that you all are eating, whether it's carbs, whether it's proteins, whether it's fat, whether enough nutrition is going for the baby. Don't bother about that. Think about what stays in. Even if one of you wants to have only fruits throughout the day, that's staying in, or some of you may want to have only curd rice, or it may be just biscuits. It does not matter. Something has to stay inside. So every couple, split your meals, because looking at an entire plate of food itself may cause that distaste and acidity. You may want to throw up. So split your meals, have small amounts every 2 hours, something to feed the acid with something, and avoid things which cause a problem for you, because the diet has to be tailor-made. It cannot be, because we have women asking us, can I eat this? Can I eat that? It doesn't really matter what you are eating. It has to suit you particularly. We have a lot of women who ask us, is Chinese food safe? I usually ask them, what are pregnant women in China eating? They are eating Chinese food, and their population is like so high, and they're all like, intelligent and doing very well. So there's nothing, see that Ajinomoto, which is there in Chinese food, it has to be consumed in that high a quantity for it to cause any problem to your baby. So, and any of you who's going to have Chinese food is probably once in a month or once in 2 months, where that quantity is so small that you don't have to restrict it. But stick to what suits you fine. Okay, what we usually say is, do not go onto the streets and eat something, pani puri and stuff like that, because that may not suit you. Your immunity is going to be slightly lower. Your gastrointestinal tract may overreact, and it may lead to more vomiting, nausea, and all that, especially in the first 3 months. Eat safe. And women who are having a lot of acidity, we tell them not to lie down as soon as they eat something. Wait, sit up propped, or even lie down propped, so that the digestion takes place. The food goes from the stomach into the lower gastrointestinal tract, and the digestion continues. So these are simple ways to avoid heartburn and indigestion, which all of you need to do. This will really help take you through, especially the first 3 months of the pregnancy. Next slide, please. So once we are done with this major symptom, as I already said, avoid food that may provoke the acidity, vomiting, and gastritis for y'all. Caffeine, a lot of people ask us if they can drink coffee. Coffee actually does not cause any problem to the baby. There are myths that, drinking more coffee will make your baby dark. That again is a very, very wrong thing. Coffee does not make your baby dark. It is a stimulant, and it can cause hyperacidity. So if you are already having hyperacidity, avoid coffee. But if you are able to have 1 or 2 glasses per day, there's no harm. You can have caffeine, but alcohol is a big no. Kindly avoid having alcohol during your pregnancy. And obviously, when we're talking about alcohol, smoking too tends to cause a lot of problems with the baby's formation, baby's growth, and etc. That's also a big no in pregnancy. So avoid food that cause a problem for you specifically. Next slide. Another common symptom is swelling of the feet. This is called pedal edema. We will deal with this in detail a little later. It's a very common symptom. A lot of women, especially in the late second and third trimester, will complain of swelling of the feet. Please remember that this is a physiological change. What I mean by physiological is something that happens naturally and normally during the pregnancy, and it doesn't need to be treated. The opposite of physiological is pathological. Pathological means that there is a problem that needs to be treated. So swelling of the feet happens naturally during pregnancy and nothing much can be done about it. This is one of the reasons I said drink lots of water, because a lot of the fluid is getting into the space outside the blood vessels. So you need to hydrate yourself very well. At the most, the feet can be kept elevated on top of pillows or on top of a stool, even when you're sitting down, for your comfort level. But this is not a worrying symptom. This is not a worrying symptom. It happens to a lot of women. As long as your blood pressure stays normal, we don't worry about the pedal edema or the swelling of the feet. Backache is another very common symptom. Next slide, please. Low backache, lot of women will experience some amount of low back pain right from the beginning of the pregnancy. So I usually tell women not to sit for very long time, because most of us are computer professionals. We need to sit at one place during the work. So do not sit for hours together. Get up after every hour or so, walk around a little bit, come back and sit. And posture is extremely important. Please make sure that you all are sitting up straight. We are human beings, not animals. Our spinal cord is supposed to be straight like this and not like this. The curvature, if it becomes like this, then the backache is definitely going to be there. Keep a bolster or a cushion at the small of your back to remind you that you're not supposed to slouch, that you're supposed to sit up straight. And these small things will definitely help in bringing down the back pain. And again, the back pain is something that we deal with post-delivery. When women are feeding the baby, the posture tends to be very, very wrong. And at that time, again, we tell you, when you all are discharged from the hospital after the delivery, we tell you the importance of maintaining a good posture while feeding the baby, because breastfeeds are going to go on for a year and a half after you deliver. So posture, most important. Of course, during the pregnancy and even after the delivery, we will be giving you calcium and vitamin D supplements, which are going to improve the strength of your backbone. So these are the small things that you can do to avoid the stress on your back, but some amount of strain is known to happen. We can manage by applying local ointments in that area, giving hot water fomentation as and when required, but please be seated or lying down in a position which is most comfortable to you. Next slide. Right. So there are, during the pregnancy, as I said, quite a few visits may be there. And it is not like in the olden days that, women never even used to realize that they are pregnant till their tummy started showing, no checkups, home deliveries. Obviously, we are not in that state right now. So technology is advancing. You and I are talking today because of the advances in technology. So we have more and more investigations, but please remember that none of them are invasive. We are not really going to do anything major to you, which is going to have any side effects. We have ultrasounds. Very rarely, if there is a problem, then only do we suggest things like amniocentesis. Otherwise, the diagnostic tests are usually blood tests and ultrasounds, which periodically, when done, will tell us about your baby's well-being. So once you start coming for checkups, we will usually give you the entire gamut of what are the vaccinations during the pregnancy, what are the important tests that we do, at what stages do we do the ultrasound, what are the blood tests, the whole thing we will explain to you, the gamut. So important not to worry about the repeated tests or the visits, but these are all have become mandatory. With more and more advance in science, we are offering a better way of picking up any small problems at an earlier time so that we can deal with it much easily as compared to the olden days that used to be. Next slide, please. So please keep in touch with us. And towards the end of the pregnancy, of course, we will be monitoring your baby a little more frequently. So in the initial 3 months or so, again, we will be seeing you every 2 weeks. Then it becomes, the checkups become once a month. And towards the end of the pregnancy, that is in the last month and a half or so, again, we will start seeing you more frequently once a week, because that time becomes important to monitor your baby, whether you are high risk or not. We will be talking about high risk pregnancy a little later, but every pregnancy is precious. Whether it's high risk or not is a different issue. That we find out by regular monitoring. Which pregnancy becomes high risk or which pregnancy is low risk, by regular monitoring, we will be able to pick up at a particular point in time. Next slide. Some of the common complications, I'm sure there are going to be a lot of questions on this, and we will deal with it. Unfortunately, some common complications, especially in our country nowadays, one of them is gestational diabetes, next slide, which is high blood sugar in the pregnancy. So we will be dealing with that also. Some other problems can be high blood pressure. I was just mentioning now that if there is swelling of the feet, as long as it is not associated with a high blood pressure, please do not worry about it. But preeclampsia or pregnancy-induced hypertension is one of the other complications that some women may have, especially in the last few weeks of pregnancy. Next slide. Certain other things, when you are in labor, sometimes the baby's heartbeat may drop. And that is, in our parlance, called fetal distress, for which we may need to take certain decisions at that point. So these are the other complications. And occasionally, next slide, some women may end up going into labor slightly earlier than the due date. So your pregnancy is usually calculated as 40 weeks from the first date of your last period. So we usually ask you for the LMP, or the last menstrual period, and your due date usually falls on the 40 weeks from the LMP. But after 37 completed weeks, every pregnancy is considered to be term. When one will exactly go into labor, your guess is as good as mine. But after 37 weeks, a baby which is born is fully grown, fully mature, fully developed, and is not considered preterm. But if anyone happens to go into labor before 37 weeks, then that is considered preterm labor. And usually, if you come in early enough to us with rest, with some medication, it is possible to stop the labor and prolong the pregnancy till we reach a comfortable gestational age for the baby. This is just for mentioning the problems that can happen, that you all are aware of, but not to worry you all. So kindly seek help from us whenever there is an issue. And we also suggest that whenever you come for your checkups, please make a note of all your questions, all your doubts, so that you can clarify everything with us, because we are here to help you through. And like I said before, do not Google and search the internet and take wrong information and get worried about things. We are here to solve your problems. Kindly keep in touch with us so that we can tell you what is right, what is wrong. And we usually never hide anything from you. If there is something, if there is a problem, we will tell you, and we will tell you how to deal with it. So do not worry. Like I always tell women, because most of the time, women and families are extremely worried throughout the pregnancy. They think once they reach the delivery point and once the baby is out, everything is done. To be very honest, that is the beginning of the story. Let the baby come out and then your journey starts. So please have a good support system around you to help you through that journey once the baby comes out, because you do not want to struggle on your own, taking care of the baby, the breastfeeding, the diaper changing, the burping, the problems that you yourself may be having dealing with, post-delivery, the pain, the discomfort and all that. So get a good support system. For women for whom it's a second delivery, you might have to take care of the first one as well. So keep that in place, keep the plan in place as to how you all are going to deal with yourself, the baby, the family, the surroundings, everything. Because this is nowadays a once or twice in a lifetime experience. It's not like in the olden days that, 10, 12 babies used to be born in a family, once or twice. And this is a time for you all to enjoy the pregnancy and post-delivery phase and not be worried and tense with everything that is happening around you. So let us move on. This was just an introduction, a brief introduction to tell you all what all we will be dealing with. Please feel free to key in your questions and do attend our childbirth classes, our breastfeeding classes, as well as the parenting classes, so that you have an actual insight as to how to go through the entire process of pregnancy and childbearing. Please key in your questions so that we can deal with the answers whenever we can.